We didn't understand how serious the problem was at first. We knew that milk would make her throw up. That was the first time. The second time it made her throw up and she got hives, which was scary. But it wasn't until the third time, when she drank down a whole cup of milk at school by mistake and almost choked to death, that we really understood how serious it was.
Someone told me the nuts on a Danish were almonds, and lo and behold, they were peanuts. I ate them. My throat got very scratchy right away, stomach cramps, diarrhea, and then gasping for breath to the point where that was it. I passed out.
I remember running into the bedroom to my husband, crying with David in my arms. He can't breathe. I think he's going to die. And that was the most frightening day of my life.
For people with food-induced anaphylaxis, all it takes is one bite or one sip of the wrong food to bring on a severe allergic reaction. It's a life-threatening nightmare for all those involved. But with knowledge and quick action, an allergic reaction can have a happy ending. Jenny Troe is an energetic 5-year-old. Kathy Sheehan leads a normal life, but always watches what she eats. And David Parkinson celebrating his 3rd birthday with a homemade milk-free and egg-free cake.
It's terrifying when you know that your kid could die if you don't do the right thing.
Where are the kids?
This video is designed to help you learn how to do the right thing, whether you're the patient, the parent, a family member, caregiver, or school staffer responsible for a person with food-induced anaphylaxis. You'll find out what anaphylaxis is, how to prevent episodes from happening, and what to do if a reaction does occur.
There's a large lack of awareness, I'd say, across the board, that this is a very, very serious thing. You know, it can be equated to penicillin allergy in people. It's poison.
You'll hear more from the families you've just met and from one of the country's leading experts on food allergies, Dr. Hugh Sampson of Johns Hopkins Children's Center. While the information in this video covers most cases, remember that each patient is different, so check with your physician for the exact procedures to follow in your case. Anaphylaxis is a sudden, severe, potentially fatal allergic reaction. It can be caused by food allergies, insect stings, or medications. The most common food allergens are peanuts, nuts, milk, eggs, soy, fish, shellfish, and wheat. But there are others as well. While the likelihood of developing allergies tends to be linked to heredity, the chance of having an anaphylactic reaction doesn't seem to be. However, people with asthma may be at an increased risk. Some children will outgrow some or all of their food allergies.
Our immune system normally produces antibodies and programs cells against harmful organisms such as bacteria. But in an allergic patient, the immune system responds abnormally, reacting against things that are generally considered to be safe, such as foods.
For instance, if someone's allergic to peanuts and eats one accidentally, the body sends out an army of chemicals, including histamine, to combat the invader or allergen. Those chemicals inflame tissues in the mouth, eyes, throat, lungs, stomach, and skin, which can result in difficulty breathing, hives, abdominal pain, vomiting, and even loss of consciousness.
Her face was very pale. She had hives. And it was clear to me that she was in some way unable to breathe or swallow because she was drooling and was unable to speak.
I start to get stomach cramps. I have diarrhea. And then very slowly, it's very difficult for me to breathe. And that builds gradually over about a 30-minute period for me to the point where I start to gasp for breath, and it's suffocation.
Many parents think that all anaphylactic reactions are the same. In fact, they differ in many individuals. Some individuals may just experience some itching and hives on the skin with some stomach upset, whereas others may start off with tightening in the throat and severe breathing difficulties.
The timetable of the reaction can also vary, from a couple of minutes to an hour. It's vital to get a proper diagnosis and a treatment regimen. The key here is to see a specialist, a board-certified allergist. We'll give you an 800 number at the end of this video to help you find one in your area. He or she will understand many of the nuances of anaphylactic reactions that aren't considered in a general medical program. An allergist will take an extensive history of the patient and may perform skin or blood tests, and in some cases, food challenges. Avoidance is the key to preventing food allergic reactions and anaphylaxis. The best advice is to steer clear of offending foods. Reading labels is a must, especially since many foods are hidden or unexpected ingredients in other foods. For example, if someone's allergic to milk, it's obvious that they have to stay away from foods that say milk on the label. But they also must look for words like whey and caseinate, which are milk proteins. And don't be fooled by non-dairy products either. Take a close look at the label. At home, practicing good kitchen hygiene is very necessary, especially when the rest of the family is allergy-free. Mary Troe, Jenny's mom, organizes her kitchen around her daughter's milk and nut allergies.
This is how we keep our refrigerator. We keep dairy products up on the top shelf. Here's some lasagna and some muffins that have whey in them. And in this drawer where we keep cheese, different kinds of cheese. Everything else on this shelf, this shelf, this shelf. And down here should be perfectly safe for her to eat.
Outside the home can be an even greater challenge for people like Kathy Sheehan, who's allergic to peanuts. At restaurants, she and her husband Harvey have to convey the gravity of her allergy.
Do you have any questions about the menu?
I do. I have a peanut allergy.
Okay.
Very serious, to the point of I would die if I have anything with peanuts.
Okay.
So I'm wondering if you could ask the chef if there's anything that I need to stay away from. It's not that you want to scare people to death, but you cannot just say I'm allergic to peanuts. That will not cut it. You have to say I have a life-threatening allergy to peanuts. I can die if I eat peanuts. You have to, I think, take it to that step, because otherwise people will not take you seriously.
The good news is that there is something you can do if a reaction occurs. Just remember to act fast and try not to panic. Check with your own physician, but the key piece of advice is that the allergic person must carry epinephrine on them at all times. It's available for home use by prescription under the names EpiPen, Anagard, or EpiPen Jr. for children. I'm sure you've heard of people carrying emergency medication for bee stings. Well, this is the same medication. These auto-injectors contain a dose of epinephrine, also known as adrenaline, which helps to stop the reaction. They can be self-administered, or in the case of a young child, administered by another person, and should be used as soon as you realize an allergen has been ingested. It's also wise to use a liquid antihistamine after the epinephrine.
I think it's very important for individuals to understand how important epinephrine is in the early treatment of anaphylactic reactions. When we review the literature on fatal reactions, it's very apparent that epinephrine was not used early on. This is the first-line drug for a reaction, and this is the drug that you should go to if you're experiencing any symptoms.
It's not something that you can wait and see if your reaction is going to get worse. You know it is.
I knew that Jenny was having an anaphylactic reaction. I knew that the EpiPen would not hurt her if it turned out to be unnecessary. And we just did it. It was like any other unpleasant thing, you know, when you take a child's splinter out or you give a child some medicine that she doesn't like. And there's no doubt that the EpiPen hurts, but it's over very quickly. And, you know, you really feel like you've done a service to the child by acting so fast.
Hello, this is Steve Tro. I need an ambulance. My daughter's having an allergic reaction to milk. She's in anaphylactic shock.
After you use epinephrine, you must immediately go to the nearest emergency room or hospital for treatment. The epinephrine only buys you 15 or 20 minutes until you get professional help. It's best to call 911 or your local rescue squad so that paramedics can start treatment in the ambulance on the way to the hospital. Be sure to tell the dispatcher the patient is suffering from anaphylaxis and to bring more epinephrine, since not all rescue squads routinely carry it.
This is a 16-year-old female that is allergic to peanuts and may have eaten a cookie with peanuts in it. Started having trouble breathing. And
Epi at home?
One of the things we stress to our patients is that they need to get to a hospital. If a severe reaction takes place where they get closing of their throat or have severe breathing difficulties, the people in the hospital can take appropriate measures that can't be taken outside of a hospital.
You doing okay?
Yeah, I guess. Okay, I'm working on the IV over here.
If they get to a hospital and they feel better, they shouldn't just turn around and leave. They have to remember there can be a second phase to these anaphylactic reactions, and they should stick around for 3 to 4 hours before they leave.
Doing just fine. Is breathing getting any easier? Good.
To review, recognize the symptoms and react quickly. Use the EpiPen or Anagard and a liquid antihistamine. Call 911 or your local rescue number. Go to the hospital immediately. If advised to do so, stay at the hospital under observation for several hours. A good idea is to practice an emergency procedure drill, much like a fire drill. There are even EpiPen trainers available for this purpose. For parents of a child with anaphylaxis, there's nothing scarier than sending their milk or peanut allergic child to school, where every child is drinking milk or eating a peanut butter sandwich. It's vital to take plenty of time to discuss your child's allergy with school staff members, just as Susan Parkinson did at her son's preschool.
He'll probably spit it out. He starts coughing violently. And also there's constriction in the throat so that his voice starts to get like that. So that's almost always a tip-off of him having a reaction. I had to talk to the school and really make it very clear about what his allergy was all about, what to do, and that they consult me about everything, especially things like snack time and even art projects where they might use something that he's allergic to. Give him now. What I brought with me is an EpiPen trainer. This is what the EpiPens basically look like, but this is so that you can get the feeling of what it's like to use an EpiPen and how much pressure it takes to activate the self-injector. You take off the gray back, put it in your fist like this, you put it into the fat part of the thigh, and you push until it clicks, and you hold it in for 15 seconds. My worst nightmare came true a few weeks ago. I came in the house and got a call, and it was David's teacher saying that David had had an attack. She said, "We've given him the shot. We're getting him medical attention. He's on his way there now." And he did exactly what I asked him to do. I saved his life as far as I'm concerned.
While people with food allergies have to avoid certain edible ingredients, there are a few ingredients that are vital to living a full life. These include love, understanding, and acceptance of the allergy and all the anxieties attached to it. Kathy's husband is a perfect example.
He's wonderful and compassionate and very supportive, but when he does seem to be upset by my what seems to be overreacting to him. It bothers me, but I can understand it.
The other day, my son and husband were going to a street fair, and I said, do you have the EpiPen with you? He said, oh, what do I need it for? He's not going to eat anything. I said, you take it, and you take it everywhere.
Why am I laying down? I think a lot of parents live in fear that they're going to make a mistake and give their child the food accidentally. I think we have to remember that we're all human. I have a daughter that was egg allergic, and I gave her a bite of my sandwich that had mayonnaise in it, and she developed a reaction. We have to face the fact that we can all make mistakes.
I mean, the feelings about the allergy are that it could be a lot worse. You take it in stride and go on, because it's the only thing that you can do. And that is the attitude I think it's most important to communicate to the child, that she not feel sorry for herself. I think that it's very important to convey as much an air of normalcy about this as possible.
All it takes is one look at these children to see that they're growing up happy and healthy. There are bound to be days when you feel frightened or uncertain, but just remember, you're not alone. In addition to your allergist, there are allergy organizations and support groups which can answer your questions and help you feel less isolated. And above all, keep in mind that even 5-year-old Jenny understands why her parents are so careful about what she eats.
It's because she loves me.
That's right. How much time is it?
More than A.
That's right.